How are you? It is Monday afternoon, and this is the Miami-Dade Chamber of Commerce Monday Connection. And before we get started, a word from our member, our sponsor.
My name is Amber Longhorn, and I am the Director of Jackson Health Systems Small Business Enterprise Program. Jackson is proud to partner with the Miami-Dade Chamber of Commerce in bringing you this video series. We hope you'll gain valuable information and tools on doing business in Miami-Dade County, but especially with Jackson Health System. We invite you to visit us online for more information at www.jacksonsmallbusiness.org.
So I'm back, and welcome again to another member connection with the Miami-Dade Chamber of Commerce. And today we have Mr. Jean D. Pierre, LCSW MBAHA with the Community Health of South Florida. Hey, how you doing, my brother?
Good morning. Thank you for having me this morning, Mr. Knowles.
Absolutely, absolutely. So, what is all that behind those letters? Let's get started. We're getting to know you a little bit, and then we'll talk about the community health.
Okay, well, my name is Jean Pierre. I like to be called JP. I've been with Community Health of South Florida for 12 years now. I'm actually a licensed clinical social worker. I have a bachelor's, master's in social work, and I actually have an MBA with a specialization in healthcare administration.
Okay. So, you spent a lot of time in class.
Yes, a lot of time in class. And the last credentials, that was a little bit brutal because I was during the pandemic and it was 100% online, not my traditional learning style.
Right. So a bit challenging, but you got through it, right?
Yes, I got through it.
So, Community Health of South Florida. I know it's been around for quite a while. How many years has it been around?
Actually, we are celebrating our 50th anniversary. We've been around since 1971.
Okay.
So 50 years serving the South Dade and South Florida community.
Wow. And its main headquarters is where?
We have 11 sites. Our main location is at our Southwest Miami-Dade location, which is at 10300 Southwest 216th Street in Miami, Florida.
Okay. So, again, what got you into, basically behavioral science, it's health work? What steered you in that direction?
Well, I actually work in administration now, but I started as a social worker. I've always had a passion for working with people, making a change. Came to work at CHI in 2008, and my passion has not changed. I've always had a passion for working with the underserved and working for a safety net provider. So the ability to make a difference has always been my priority.
Right. So I know we hear, like I said, you started out as a social worker. So tell the audience, I mean, I'm sure a lot of people know what a social worker does, but explain that role to people.
Social workers actually work in a large number of different positions. But as we look at Florida statute actually defines a social worker as someone who has a bachelor's or master's level degree in social worker. But social workers work in a wide variety of positions, from corrections, nursing homes, social service organizations, behavioral health, healthcare. So there are a large spectrum of different disciplines social workers actually work in. But I think that we all have one purpose in common, and that is actually to provide necessary services to the community and to be a helping hand to those in need.
Right. Well, I'm making sure that I'm connecting us to on my Facebook platform. So I'm doing some sharing right now. Give me 1 second.
Take your time.
So I know, like you said, during the pandemic, you were going to class, but also in the middle of the pandemic, we had the issue or the murder of George Floyd.
Correct.
And a lot of conversation has been about defunding the police. But not necessarily taking away the responsibility of the police overall, but when I think about social service work, I believe a lot of the conversation has been that a lot of more social service input should be into responding to certain calls for the police. Any thoughts behind that?
Absolutely. I think that we should be working hand in hand with law enforcement. A number of the jurisdictions in Miami-Dade now have CIT officers, and those are crisis intervention officers that are trained specifically to work with individuals that may be having some type of behavioral situations. So that being said, I understand there is some proposal and some possibilities where you will see an increased presence of social workers participating with law enforcement activities as far as going on some of those 911 calls, going on some of those outreach calls. So I understand that is in the making. I don't have much details, but I know a number of jurisdictions throughout the country has actually lowered the percentage or the budget of law enforcement officers on the actual streets and incorporated more social services, more social workers as far as interventions are concerned.
Yeah, I think obviously as a social worker, you're trained to engage with people. You're trained to understand some of the issues that they're going through. So I think it's a good idea. Definitely, I'm not condoning defunding the police, but definitely condoning the assistance of the experts like yourself.
Mhm. Absolutely. And I think that law enforcement has done a good job. And I do encourage the community as a whole that if they are engaged in the mental health of someone in the community that's suffering from mental health, that they always have the option with any law enforcement jurisdiction to ask for a CIT certified officer to come to the scene of the incident.
Yeah, no, that's a good point that you bring up, that they have that option. I don't see, when you see a lot of these, I guess, reports, or you see a lot of this on social media now, because you don't necessarily see it on the news. You see more response from social media perspective. And I guess I would have to say I have yet to see, you said, a CSI specialist on scene.
It's actually CIT. And most of the law enforcement jurisdictions, they have a little emblem that says CIT, and that way you know they are trained in an evidence-based intervention. And you'll kind of see it on their uniform that they are a CIT officer.
Okay, so they're the actual officer who has that training.
Who has gone through the 40-hour training, yes.
Okay.
And then there's an international evidence-based training that they have to go through.
Okay. Now you say it's a 40-hour training.
Correct.
Is that a continuing training that they have to do over the years, or is it one-time 40-hour training?
I know the initial training is 40 hours. I have not taken the training, but there are CIT trains, but it's in 2,700 communities throughout the country. And I don't know what the refresher, but I'm assuming that there is some type of refresher training that they're responsible to attend on an annual basis.
Yeah, I would think that there would be, and hope that they are doing a continued type of training. CHI, how many clients do you all serve?
Last year we served 84,000 patients. So that number continues to grow. We actually have 11 health campuses. We're in 35 school-based locations. We have a mobile dental trailer, and we recently launched a mobile medical unit, which actually provides services to the different housing communities in Miami-Dade.
Okay. And I'm sure since the pandemic has basically devastated our communities across the United States, your services have probably increased quite a bit.
Absolutely. Specifically in the behavioral health line of business for our organization, we actually had a 9% increase in the number of encounters, which were actually visits year over year compared to 2020 compared to 2019. So we definitely did see more need for behavioral health patients during the pandemic. And I'm looking here, and actually in 2019, we had 79,400 unique patients, and we had 278,500 visits. So that's a more accurate number of the number of patients that we actually saw in 2019.
Okay. So with that, I would assume that there is a continued need for people to come into your business, I guess I would say, for more social workers.
Absolutely, and we've definitely been significantly involved in this COVID-19 pandemic. We were the first organization to actually do drive-through testing in Miami-Dade. So we've actually gone through the different phases of testing, administering vaccines, and now we are preparing to launch our booster vaccine program. So it's something that definitely we are committed to. And from the social services perspective, we actually provided telehealth services prior to the pandemic, but once the pandemic really hit, we were able to pivot very quickly and start offering those services via telephonic and via telehealth. And that's why we were able to see a 9% increase in our total behavioral health encounters.
Well, as you said, here we're on this platform. And as you said, you've increased your service from a telehealth perspective. How does that work?
During the pandemic, we were actually, through all disciplines, we were able to, you could actually pick up the phone, speak to your provider, complete your session exclusively telephonically. As of July 1st, they've changed the regulations, and now you have to have an audio video connection. You cannot exclusively just have the telephonic encounter. So that has created a barrier for some patients, but we never stopped offering in-person visits. So all of our centers were always open, and our patients were always able to come into the centers and to see their providers. I will say a lion's share of the provider patient appointments were via telephonic or telehealth during the high peaks of the pandemic.
Right. So I know you said you're celebrating your 50th year. Anything special going on?
Absolutely, and that's a great question. We have been celebrating our 50th year all year. Our grand bang event is actually September 25th, and that is our 50th anniversary gala, and that is going to be September 25th at the DoubleTree Convention Center, located by the airport. The tickets are on sale, and we are looking for a large turnout. We will have specific COVID-19 measures in place for that event, but that is our grand event to celebrate our 50th anniversary.
Yeah, I'm glad you mentioned you're going to have COVID protocols in place. The chamber, we're working on our gala for December. So I'm actually asking you, how are you all dealing with that? Because obviously, with the spike of the variants coming up, in-person events have been a bit challenging. But at the same time, as a chamber president, I said we got to continue to live. We got to continue to keep businesses moving, and having events. Our event business has been hammered probably harder than any other business because people could not gather. Talk about that from a social perspective. Obviously, how are you all looking at it?
There's some different concepts they have not actually finalized, but they're looking at vaccinations being required, PCR tests, limiting the number of individuals that are sitting at the tables. They have ordered some specialized air purifiers, and they'll also be offering rapid testing at the site prior to admission. There will be bands that will be assigned to individuals, clearly displaying that they have met the necessary COVID-19 protocols prior to admission. So those are just some of the things that they will be implementing prior to the admission to the gala.
Okay. Well, I probably definitely will follow up with you on that, as I said, as we begin to prepare and plan for our event in December. What would you like our audience to know that we haven't spoken about?
Just that CHI has been a long-standing pillar in the community. I want to ensure that the community knows that our mission is to deliver safe, accessible, compassionate, culturally competent, quality healthcare services to the people of South Florida, while training the next generation of healthcare professionals. Our motto is patient care comes first. As I mentioned before, we actually have the 11 health center sites. We have 3 sites in the Monroe County area, 1 in Tavernier, 1 in the Middle Keys, and 1 in the Lower Keys that is scheduled to open in late October, early November. We have a mobile medical van that serves the community, and we are very proud of that. We actually provide services at Perrine Gardens, Arthur Mays Villas, Pine Island, and Homestead Gardens. So those are some of the highlights that I wanted to mention. As far as services are concerned, we provide primary care, behavioral health. We have an inpatient crisis stabilization unit here in our Doris Isom location. We have dental services, laboratory services, OB, GYN services, optometry, pediatrics, pharmaceutical, of course, psychiatry and mental health, translation services, and we offer transportation, and we actually have 2 urgent care centers. So that's some of the information that I did want to cover as far as our services are concerned. We actually have 700 plus employees that are represented by 30 different cultures. And our overall budget is about $70 million.
Wow, that's a pretty big budget. So, and again, you do say you are in schools as well, and you serve students as well, as correct?
We actually have a partnership with the Miami-Dade Children's Trust, and we actually are active in 35 schools where we have a health suite in those schools, and we provide preventative and ongoing treatment in those schools.
Wow, that's great information. So, folks, if you're listening and you're looking for some health support, health advisors, CHI has been around for 50 years. I think they know what they're doing. And we have a great partner in the Vice President of Jean D. Pierre, JP. JP, thanks. If they want to get in touch with CHI, how can they do that?
Our main number is 305-253-5100. They can also go on the website, which is www.chisouthfl.org. You can find a plethora of information on the website.
All right, great. If you want to learn more information about the Miami-Dade Chamber, you can go to www.m-dcc.org, or you can call the Chamber at 305-751-8648. And coming up on October 29th, you can sign up for our Dorothy Baker Golf Classic. It is the 30th annual. You can, again, reach out to the Chamber for more information about that, 305-751-8648. And our holiday gala is December the 4th. I almost forgot the date. Working on that. And so to find out more information about that as well, call the Chamber at 305-751-8648. Jean, I just want to thank you for joining us today, and thank CHI for being a member of the Chamber. Look forward to talking to you soon.
Okay, take care. Thank you for having me. Have a wonderful week, everyone.
You as well. Thank you.